Rheumatic fever. We will go through the pathogenesis, clinical features, diagnostic criteria, and treatment of rheumatic fever. It is a systemic disease triggered by pharyngitis with group A beta hemolytic streptococci. Most common valve involved is mitral valve. It can lead to atrial fibrillation, irregular pulse or rhythm. Acute rheumatic fever presents with mitral regurgitation. Chronic rheumatic fever presents with mitral stenosis. Pathogenesis. It is a type 2 hypersensitivity reaction in which antibodies against M protein of streptococci cross-react with cardiac antigens. Occurs 10 days to 6 weeks after pharyngitis. Histology includes Askoff bodies. These are pathognomic, composed of Gantt cell surrounded by macrophages and T lymphocytes. Jones criteria. It includes major criteria. Remember it by using mnemonic PES or MES. P stands for pancarditis, which includes endocarditis, pericarditis, myocarditis. M stands for migratory polyarthritis. E for erythema marginatum. S for sydenham chorea. Second S for subcutaneous nodules. Moving on to minor criteria. Remember it by mnemonic FRAP. Fever, raised and CRP, arthralgia, prolonged PR interval. To confirm the diagnosis, we require 2 major criteria plus evidence of recent streptococcal infection. Or 1 major plus 2 minor criteria. Clinical features. Remember it by using mnemonic MES or PES. Migratory polyarthritis, pain at one joint then shifting to other joint. Pancarditis, includes endocarditis, pericarditis, myocarditis. Erythema marginatum, red color rash with raised edges and clear center. Subcutaneous nodules, these are mobile painless nodules mainly on the extensor surface of joints and spine. And Sydenham's chorea. Special type of murmurs in rheumatic heart disease, Carey-Coombs murmur. Investigations required for diagnosis are CBC, ESR CRP, throat swab, ASO titers, chest X-ray, ECG, echocardiography. Treatment includes antibiotics benzyl penicillin or phenoxymethypenicillin. For penicillin allergic patients use erythromycin or cephalosporin. Use aspirin as analgesic. For treatment of chorea, haloperidol or diazepam. Primary prevention and secondary prevention. Primary equals prevents initial development of rheumatic fever. Treatment of streptococcal pharyngitis with short course of penicillin and erythromycin. Secondary prevention equals prevents recurrent attacks but doesn't protect from infective endocarditis. Treated with penicillin and erythromycin. Thank you for watching the video.